So we are starting with the vertebral column. So quickly going through the content which is related or relevant for us. This is our vertebral column consisting of all the vertebrae that we have stacked one after another, like cervical segment, thoracic segment, lumbar segment, and sacrum and the coccyx. Cervical segment had 7 cervical vertebrae, thoracic 1, 12 and then lumbar 5 of them, and the sacrum is single which has a fused 5 sacral vertebrae, and then we have the coccyx again that is fused 4 of them. So these are the 33 vertebrae that is present in our body. Now this particular vertebrae which is present in here holds or makes some like a structure, so we call them as the curvatures of the vertebrae. Now within this particular vertebrae, between them we have a cartilage placed in it. We call them as intervertebral disc. What do you call them as? Now intervertebral disc which is present in here is having 2 components. One is a central component which is present in the blue shades as you are seeing here. We call them as nucleus pulposus. We call them as, and surrounding that we have a fibrocartilage. We call them as annular fibrosis. So we have 2 components there, so which is having central component and a peripheral surrounding component which is known as annular fibrosus. This central component which is known as nucleus pulposus is developed from notochord which is an ectodermal in origin, and this annular fibrosus which is around this fibrous cartilage which is mesodermal in origin. So these 2 components are present between these each of this particular intervertebral disc, alright, and these intervertebral discs are placed where? In between this particular vertebral bodies. So we have this vertebral body there above and down, in between them we have this particular intervertebral disc. We have this fibrocartilage. This fibrocartilage is made of 2 components, nucleus pulposus and annular fibrosus. So this fibrous component outside is made of fibrocartilage, is originating from the mesoderm, and the central one notochordal, that means ectodermal in origin, alright. Now coming to the curvatures of this particular vertebra. So these vertebra having curvatures which is not a straight structure, it has got bends, we call them as curvatures. We can classify the curvature into 2 components, primary curvature, secondary curvature. Primary curvature that we are born with, it is a kind of circular cartilage which is a C-shaped curvature that we are born with. Now later on as we progress through life, we develop some more bends or curvatures, we call them as secondary curvatures. So these primary and secondary curvatures are normal that we have in our bodies. So primary curvature which was a C-shaped cartilage or a C-shaped curvature is we are born with. Later on as we progress, we develop some kind of curvature, we call them as secondary curvature. The 2 curvatures that we acquire which are prominent of this nature, which is present, one in the neck region, we call them a cervical secondary curvature, and the second one is a lumbar secondary curvature. So this particular curvature, initially we were a curvature like C, like this bend, C-shaped cartilage curvature we had. Later on we have this particular cervical cartilage curvature came in and the lumbar curvature came in. So this particular curvature which is cervical curvature, we have acquired that with movements of this upper limb or this particular neck region. We call them as acquired secondary curvature which is in the cervical region, and second curvature which is lumbar curvature which is present in the lower part of this particular back region or the junctions of this particular back and the pelvis, we call them as lumbar curvature. This lumbar curvature is acquired as we start to walk, begin to walk, move the pelvis, so we acquire the secondary curvature out there which is known as secondary lumbar curvature. So these are the 2 normal things, primary curvature that you are born with, the C-shaped cartilage curvature. So which was there in the fetal position, the fetus was anti-flexion, anti-vertical, like a bend like this. So which is having got all flex positions which is in a fetal positions we have. So which is concave anteriorly, so we have a concavity single curvature. Later on we have this convexity anteriorly developed in the cervical region and the lumbar region. We call them as cervical and lumbar secondary curvature. These are the two curvatures that we are having normally. Apart from that, we may develop some kind of pathological curvature which is not so good curvature for us. So, these curvatures, apart from these primary and secondary, anything beyond that we can call them as pathological curvature. Those pathological curvature are of maybe of different types. So, there are two of them which are of point of interest for us. We call them as kyphosis and the scoliosis. The kyphosis is that we have this particular normal spine curvature like this. So, this particular normal curvature, if it is bending excessively anteriorly, we call them as kyphotic curvature. That happens with progression of age. So, if you are bending or stooping down too forward, we acquire a excessive curvature which is concavity. We call them as kyphotic curvature, which we acquire with ages. So, this was normal curvature there, which is increased curvature in the thoracic region and as well as in the cervical lower region, we get this kyphotic curvature. So, excessive thoracic curvature, we call them as kyphotic curvature. Apart from that, we may get a side curvature, we call them as scoliosis, which is a S-shaped bend. You see that? Normally curvature was there in the midline, but this particular curvature is deviated from the anterior posterior direction. So, moved right and left. So, this kind of curvature we call them as scoliotic curvature. So, which is having an excess lateral curvature, which was not normally there. So, an excess lateral curvature and excess thoracic curvature, we call them as kyphosis and scoliosis. Apart from that, we may have other curvatures as well. We have a combinations of these two together, kyphoscoliotic. So, we have excessive forward bend and again we have excessive lateral bend. So, kyphoscoliotic curvature, mix of things. Or else we may have this lumbar curvature which is normally there, which may be exaggerated like this, an excess lumbar curvature. So, we call them as exaggerated lumbar curvatures, but these are diseased curvatures. For us, we do not have to know about these diseased curvatures. I am just exemplifying this. So, these are the diseased curvatures which is present. Know the names, but do not dig deep into it. But what you have to know about the curvatures in this particular vertebrae, we call them as primary and secondary curvatures. The primary curvature we are born with, the fetal curvatures that we have. Now, as we start moving on, we have these two additional curvatures which is known as the excessive curvatures, which is present in this particular cervical region and this lumbar region, which is like a convex anterior curvatures. We have the cervical secondary curvature and lumbar secondary curvatures. So, these are the two things that you have to keep in mind, and kyphotic scoliosis we have to keep in mind. These people have got this particular curvatures, looks like deformities because of this particular bend excessively, which is yielding this particular thing. So, as I am saying, this particular kyphosis is excessive bend forward, which happens with the old ages because of the vertebra gets crammed and compressed. We may have these particular curvature problems. Now, coming to this particular ligaments which are present in this particular vertebral columns. There are several ligaments that are present between these particular vertebrae which are holding or making up this particular vertebral columns, as these vertebrae are stacked with one after another. So, these particular vertebrae are stacked with each other another like this. So, to have this particular vertebra held in normal position, we have a number of the ligaments which is present throughout the length and some of throughout the breadth. So, this particular ligaments that is related to this particular vertebrae that we have to keep in mind. Now, see that whenever you are considering this particular vertebral column, you have to place it anterior and posterior. So, anterior is this particular vertebral body, posterior is the spine or spinous process. Now, you see that this particular vertebral body, anterior to this vertebral body we have a ligament and posterior to the vertebral body we have another ligament. So, these particular vertebral ligaments besides anterior and posterior part of this vertebral body, they run throughout the length of the vertebral column. So, they run up and down longitudinally. So, they are known as longitudinal ligaments. So, these longitudinal ligaments, as they are present in anterior aspect of the vertebral column and the posterior aspect of the vertebral column body, we call them as anterior and posterior longitudinal ligament. We call them as longitudinal ligaments. Why they are longitudinal? They are running throughout the length of the vertebra in respect to what? Vertebral bodies. Anterior to the vertebral body, posterior to the vertebral body. So, anterior longitudinal ligament, posterior longitudinal ligament. Clear? Now, we have a ligament between these vertebral spines. So, we have the spines of the vertebra. Joining the spines of the vertebra, we have a ligament running. We call them as interspinous ligament. Between the spines, we have a ligament. We call them as interspinous ligament and supraspinous ligament. So, between the spines, we have this interspinous, and between the tips of this particular spine, we have supraspinous ligament. So, which is running again entire length up and down. Supraspinous and interspinous. Between the spines, again to have two ligaments. Between the spine, we have interspinous and supraspinous. Supraspinous touching the tip and interspinous between these particular spines, like this. So, interspinous ligament, as you can see that between the spines, between this length, we have this, and this one we have tips of this particular vertebral spine. Touching the tip, we have this all the way long, we have supraspinous ligament. Now, then we have this particular ligament of interest, we call them as ligamentum flava or ligamentum flavum. So, this particular ligamentum flavum is present between the lamina of the vertebra. So, ligamentum flavum is present between this particular lamina of the vertebrae, which is made of yellow elastic cartilage. It looks like yellow, that is why it is known as ligamentum flavum. So, this ligamentum flavum is present between the lamina of the vertebra. So, we understand this particular lamina, pedicel, transverse process and the spinous process. Between this particular lamina, above and down, we have this particular ligamentum flavum. So, this is a vertebra which is vertebral body. This is posterior side, this is anterior side. This is a ligament running across, anterior longitudinal. This is a ligament running back side, posterior longitudinal ligament. This is a ligament touching the tip of the spines, supraspinous. Between this particular spines of here, interspinous. Now, between this lamina, this one looks like yellow. It is made of yellow collagen fibers or yellow elastic tissues are there. It is kind of like giving a texture which gives like a stretchiness there. So, we call them as ligamentum flavum or ligamentum flava. So, this particular ligamentum flava or ligamentum flavum is kind of an important ligament that we have to keep in mind. So, 1, 2, 3, 4 and 5, these 5s are very important ligaments which is present all throughout this particular length or breadth of this particular vertebrae, from this particular cervical domain to this particular lumbar domain. Now, apart from that, we have a condensation of these things which is known as this ligamentum nuchae. In the cervical region, we have a condensation of this particular ligamentum flavum and this particular longitudinal ligaments. We call them as ligamentum nuchae, but we drop this particular ligamentum nuchae for now. We will catch it up in the cervical section. So, for now we just like focusing on longitudinal, spinous and ligamentum flavum, 5 of them. So, how they are placed? We have understand anterior longitudinal, posterior longitudinal, supraspinous, interspinous, ligamentum flavum. Clear? So, these are the things. Now, you see that this is a vertebral bodies. As you are seeing a lateral profile of this, you are looking on the sides of this. So, between this particular vertebra and this particular vertebral articulations on the posterolateral side, you see this particular slit. We call them as intervertebral foramen. We call them as intervertebral foramen that is present in between vertebrae. Now, where this particular vertebral foramen is there? It is present in the lateral side, because you are looking at the lateral profile. The anterior side, posterior side and side is which is present on the lateral side, we call them as lateral side. Now, this is anterior side and this is posterior side. So, this particular foramen you are seeing here placed in the posterolateral side. Which side? Posterolateral side of the vertebral column. So, this particular positions of this particular intervertebral foramen is present in the posterolateral side of this vertebral column. Now, what does it contains or what does it exit? The spinal nerves which is present in here, which will be exiting here, will be coming in here. So, quickly recap these things. Vertebral disc made of 2 components, which is having Nucleus Pulposus Annulus Fibrosus. Central part made of notochord. Notochord is ectodermal. Fibrosus mesodermal. That's it. Now, if by any chance this particular central part, that pulposus, breaks through this annular fibrosus and cramps the nerve, we call this as disc prolapse. So this nucleus pulposus breaks this particular annular fibrosus and leaks through and compresses the nerves which is coming through here and compresses this particular neural content. Then we call them as herniation of nucleus pulposus, also known as disc prolapse. So this prolapse looks like this. So how these things matters here? You see this lateral profile of the same picture as I am saying here, two vertebrae, and you are seeing here a side profile of it. Which side? Posterolateral side. Posterolateral side, an opening is visible. This particular thing is above down present, and this opening which you are seeing here, we call them as intervertebral foramen. This intervertebral foramen transmits a nerve. Which nerve? The spinal nerves. They are exiting from here. So this disc which is present in here, if it is compressing this nerve over here and creates a neural complication, we call them as the neural disc prolapse or herniation of disc, which is in common words we call them as disc prolapse. You understand? So what is they are compressing? They are compressing this particular spinal nerve. If it is compressing this particular spinal cord, it may be compressing the spinal cord if it is moving backwards, but normally disc prolapse moves on the posterolateral side. So this particular herniation of the disc or herniation of this nucleus pulposus happens on the posterolateral side and compresses the nerve which is exiting through here. So this is what you have to judge and see. So this is an MRI scan, as you are seeing here. You are seeing this particular spinal cord, and this is a disc, and this is a vertebral body. One body, another body. In the lumbar segment, we have this particular vertebral disc as it is going down. So this intervertebral disc is placed in between here. So see that this particular intervertebral disc, this one is intact, but look at this one, it is bulging out, popping out. This one is too popping up and pressing on this particular neural content on here and pushing this particular posterior longitudinal ligament. So here is the anterior longitudinal ligament. Here, this is the anterior longitudinal ligament. This is a posterior longitudinal ligament. Here will be the interspinous and as well as spinous ligament. So this particular disc which is pushing back, going towards the spine and pushing on the neural content. So this we call them as herniation of disc, also known as disc prolapse. Clear? And if this disc prolapse is there, patient is complaining of this low back pain or compressing this particular nerve, which commonly happens in this particular sciatic nerve roots. We call them as sciatica. Clear? So this is what we have to know about in this content. Now little bit about this particular spinal nerves or spinal cord content, which clears us from understanding this disc prolapse more vividly. So this is a spinal cord that you have coming from the brain, which has got brain stem, which is joining between the brain, cerebrum, and this segment we call them as spinal cord. It also have the same segment like cervical segment, thoracic segment, lumbar segment, sacral segment, coccygeal segment, like this. So this spinal cord is giving some nerves which is coming off these particular spinal cords. We call them as spinal nerves. There are spinal nerves which is moving from this particular vertebral column through this particular areas. We call them as intervertebral foramen. So this particular spinal cord going down hangs like a bunch of nerves. We call them as chorda equina. So this particular chorda equina, which is a bunch of spinal nerves which is hanging below from the spinal cord. Now this particular spinal nerve, as it is coming down through this particular vertebral column. So we have the vertebral column which is present between these particular vertebrae or vertebral foramens, and it is coming down like this is the main spinal cord which is going through this particular vertebral column. See that? And this spinal cord at each level, they gives rise to these nerves. These nerves we call them as spinal nerves. These spinal nerves are coming out of through this foramen. What foramen here? It is intervertebral foramen. You get this idea where from these nerves are coming? So this particular disc, if it is moving back, compresses the nerve, we get this particular problem. We call them as disc prolapse. Clear? What do you mean by the disc prolapse? And spina, chorda equina, all these things, nerves, we will be talking about it. Now, you see that vertebral column or vertebral canal, as it is going down, it has a diameter. That means it has a length and breadth as it is going down. Now as we go down above below, the diameter of this particular vertebral canal or the vertebral column diameter is gradually shrinking. So the diameter in the cervical segment, which is larger, as we go down to the lumbar region, the diameter narrows. Getting what I am trying to say? So the spinal cord is going down to this particular vertebral canal through the between this particular vertebral foramens. So this particular vertebral foramen which is present in here holds this canal. Now this particular spinal cord is going through the above down. Now this diameter in the cervical region of this particular vertebral column, as you can see, the diameter of this particular vertebral column is more above. So it has more space above when the spinal cord is going down. As it is going down, this particular diameter of this vertical canal is shrinking. What does it mean? So chances of compression there. So less room is there for the spinal cord and the spinal nerves in the lower part of the vertebral column. In this cervical region, they have much spaces. So if you are moving your neck, the spinal nerve and this particular spinal cord, the chances of the compression or touching this is less. But as you are moving this lower part of the body, there are chances of compressions or the movement is less. So as a result of that, as it is shrinking in size above down this vertebral foramen or vertebral canal, as the spinal cord is going down, the space between this particular vertebral column is less. So if by any chance we have a disc prolapse to a minor degree in the lumbar region, we have a more chances of nerve compression than that of cervical region. This is one thing. Other thing is that the diameter of the nerves, the lumbar nerves and diameter of the cervical nerves are different. The diameter of the cervical nerve is less and diameter of the lumbar nerve is more. So we have even more less space and thick nerves. So fatty guys are at the bottom and skinny guys at the top. So in the upper part we have more space but thin people living in here, and lower bottom we have less space and more fatty people or more fatty nerves are there. So we have chances of cramping of nerves is more common in lower part. So the nerve compression or symptoms of neural compression is more common in the lumbar region than cervical region. Getting it? Getting through your heads? Okay. So this is all. Now coming to the lumbar vertebra, it has the same old thing about any vertebra we have. Vertebra have got a body. This particular body is huge, robust compared to the other cervical thoracic segment as you have seen. The body has got transverse diameter is more than that of anterior posterior diameter. It looks like a kidney, and this part of the hilum of the kidney where the structure gets in comes out. So this particular part we have this robust body which is kind of like different than that of rest part of this. So this is a thoracic segment, you see the body size, and this is a cervical region. This is a cervical vertebra, you see that, so thin and so narrow is the body compared to this one, is huge, right. So the body is really huge, transverse diameter is more than that of anterior posterior diameter. Other than this we have processes, transverse process, spinous process, connecting between the transverse process and the body we have this pericell. Between this particular transverse process and the spinous process we have lamina. On the top junctions of the lamina and this we have the superior articular facets. Superior articular facet have another bunch or bulge up, we call them as mammillary process. Inferior articular process, which is projected downwards, which is going down, inverted or going above. So, superior articular facet, transverse process, inferior articular facets, spinous process. This one we call them as lamina, this one is pedicel, this part is having body. Body have got anterior and posterior thing. This is posteriorly placed. So, whenever we are holding it anatomically, you have to hold it in the transverse process, spinous process in the back. This is the vertebra, anterior margin. Here have a ligament, we have this longitudinal anterior. Here we have a ligament, posterior longitudinal, spines, spinous, interspinous, and ligamentum flavum inside to it. So, these 5 sets of ligaments are there, and transverse process, which is transversely placed. Superior inferior articular facets are holding this particular thing up. Now, coming to this particular foramen, as you are seeing here, you see this particular vertebral column. So, which is making this particular vertebral foramen out here, which is making vertebral column, and you see the diameter in the thoracic segment, which is wider, and in case of the cervical segment, so vertebral foramen diameter in the anyways, you see the diameter as well, the cervical segment. So, it is kind of like a wide. Again, as we go down, the nerve thickness gets bigger compared to the cervical skinny nerves. So, cervical nerves are skinnier than that of lumbar nerves, and the space is less in the vertebral foramens, which is intervertebral foramens, resulting in chances of more cramming there. So, this is about the lumbar vertebra. How to identify? It has a bigger body. On the sides, it do not have any costal facets, which is the thoracic region have for the articulations of the ribs. Transverse process have no holes in it, which is having in cervical segment. Foramen transversarium is there. This one transverse process do not have any foramens in it. So, this is a vertebra. Now, vertebras out of in the lumbar region, 1, 2, 3, 4, 5 are there. 1, 2 and 3 are known as typical. 4 and 5 little dissimilar, we call them as atypical. 4 and 5, alright. Individually we do not have to bother about it, rather than generalized lumbar vertebrae we are focusing in here. And vertebral foramen, vertebral canal, diameters of it, intervertebral disc, compositions of it, why this nerve compressions is more common in the lower segment than that of other region, explain it why. Alright, 15 minutes you have to answer it.